Hello students, this is the second part of the selenium toxicity. We will learn about the clinical science, diagnosis and line of treatment. About clinical science, the animal livestock shows both form of toxicity, acute and chronic. However, acute cases is rare. If acute cases occurs in livestock, or generally pigs suffer from the acute cases of selenium toxicity, they may die without showing much symptoms or sign about the toxicity. If the livestock, large animals affected from the acute cases, they may show the GI disturbances and as well as the locomotor system, or you can say the abnormal posture, abnormal gait. And one is the peculiar sign if the acute cases of selenium occurs in large animals rooted to one spot condition, means वो एक जगह चलता है, पैर रखता है, फिर the affected animal want to move, but that he is unable to move. So rooted to one spot condition is occur in the acute cases of the selenium toxicity. Now about the chronic toxicity. Chronic toxicity occurs in livestock in two forms: subacute, if the some weeks to some months exposure of selenium occurs to the animal, and in the chronic we can say this subacute case as a blind staggers condition in the livestock. And second one is chronic, when more than several weeks and months the selenium exposed to the particular affected animal, they may show the chronic symptoms, chronic toxicity symptoms of selenium, and we can say this condition is alkali disease condition, and the most of the locomotor system affected. So first of all, subacute are blind staggers. In blind staggers conditions, the animal or livestock shows the most of the vision related condition, or they move here and there aimlessly to the any object, or wandering any object. They may show blindness condition, they because the obesity of corneal obesity occurs in the animal in subacute cases. Now what about that chronic cases of the toxicity or alkali disease? In this condition, most of the locomotor system affected by the selenium. Because if several months the exposure of selenium occurs in livestock, they may show the chronic toxicity symptoms like abnormal gait, abnormal posture. After some times, the crack of the hooves, or the fracture of the hooves, and finally the slowing of the hooves occurs, and lameness means they can't move here and there because of the fractured hooves and other. And one condition in the chronic case of the selenium toxicity is peculiar for the competitive exams, is the bobtail condition or sickle cell condition. In this case, the hairs from the tail are lost, means loss of hairs from the tail of the affected animal occur, and this condition is called as cigar tail condition or bobtail condition. These are the chronic toxicity and acute, subacute and chronic toxicity of selenium. Now what is the diagnosis? What is the diagnosis process of about selenium toxicity? General general guidelines we follow, like anamnesis or history of the feed, history of the animal, clinical science, and other routinely examination. However, for the confirmatory process, we go to the laboratory examination about feed material, what they have consumed. If feed material consumed have high level of concentration, more than 25-35 ppm concentration, we may guess the animals are suffering from the selenium toxicity. However, more confirmatory test is about blood or tissue level selenium concentration. So we can take the tissue or blood from the affected animal, and we measure the level of selenium. If selenium concentration occurs in the body tissue above 5 ppm, we may guess the toxicity occurs of the selenium. These are the diagnosis. How we can differentiate from the other diseases, means differential diagnosis occur. First of all, about acute cases, because animal die without much showing symptoms or signs, so we may differentiate from the anthrax, pasteurellosis, enterotoxemia, etc. Or in about chronic cases, we may differentiate from the ergotism, because the locomotor system involves in mostly in chronic cases. So ergotism, laminitis, and molybdenum toxicity also cause locomotor disturbances. So we may differentiate from these 3-4 diseases or disorders to the selenium toxicity. Now, what about the line of treatment? The treatment, the specific antidote is not available for the selenium toxicity, or the specific treatment is also not available. So as in general or routine, we can help with the supportive or symptomatic treatment. We must take care about symptomatic and supportive treatment of the animal, and as soon as possible we may eliminate the source of the toxic agent, or seleniferous plant. If they consume by the many process like gastric lavage, you just eliminate the source of the toxicity. For other things, like you can give high protein diet rich to the animal, like linseed meal and etc, and some supplements which contains the selenium, which contains the arsenic, copper, molybdenum, you can also provide to the affected animal. However, you just note two things during treatment. You just avoid the supplementation of vitamin E. You may treat with vitamin E because this act with the synergistic action with vitamin E and condition may worse. And second one is, you don't go for ball like arsenic and other metal toxicity. You using the ball or British anti-leviside. So here don't use ball, because the renal damage in the selenium toxicity, renal damage occurs with ball. So avoid ball treatment also. So these all about first part and second part about selenium toxicity. If you all have any query, you can call me, you can ask by telephonic conversation to me. Thank you.